Well, diabetics are at risk of developing a number of complications, and that's what we're always striving to avoid. Broadly, we divide the classifications into two. The set that worry people are the microvascular, in other words, small blood vessel, and these small blood vessels are affected in the eyes, kidneys, and the nerves of the feet. So blindness, kidney failure, and loss of sensation, and even amputation remain, unfortunately, common in diabetics of long duration who have not managed the diabetes well. But the other worrying problem with diabetes is the macrovascular, the large blood vessels, and by that I mean the blood vessels to the coronary arteries and the blood vessels to the brain, the cerebral arteries. So these are at risk of clogging up, and so the risk of heart attacks and strokes is between 2- and 4-fold in individuals with diabetes. So for that reason, fatty food should be avoided, and we recommend that all diabetics, especially type 2 diabetics or younger type 1s above a certain age, to go on to medication with a group of drugs called statins, which can lower cholesterol and which we know can reduce the risk of heart attacks and strokes in the future by the order of 25 to 35%.
And that would be something that their GPs would sort out with the patient involved?
Yes, most patients nowadays are on statins if they can tolerate them, because they unfortunately they have a number of side effects which are not serious. It can be troublesome. Muscle pains is one thing that we are aware of, but the pros of statins hugely overwhelm the cons.
And the muscle pain can be dealt with. That can be alleviated by changing your regime.
It's not serious, and by going to a different drug or a lesser dose of a statin can often be tolerated. So it's always worth discussing with the GP to ask for a change. So anybody with muscle pains while taking statins should have this addressed.
So if there's one thing that you would say to anybody listening to this to advise them about diabetes or to get checked out, what would it be?
Yes, so anybody who's feeling very lethargic or very thirsty or going to the toilet more often, who's getting, especially a woman getting recurrent infections down below, and men, they should go to the GP and ask to have a blood sugar check. This is especially so if these patients are overweight and if they have a family history of diabetes. People also have a high cholesterol problem and a high blood pressure, also because there's a link between all these conditions, are at high risk, and they should be screened for diabetes if they have those symptoms.